Good morning, everyone. Today we are discussing the topic generations of dentin bonding agents. The classification of dentin bonding agents, which depend upon the generation or evolution of dentin bonding agents and according to clinical technique or number of clinical steps involved and effect on smear layer or treatment of the smear layer. The classification based upon generations or evolution of dentin bonding agents. The first classification. The first generation, during the late 1940s, Oscar Hager at the D3 division of Amalgamated Dentin, London developed the first bonding agent based on a resin monomer which contained glycerophosphoric acid dimethacrylate, otherwise known as GPDM, that could bond to inorganic component of the dentin, and there should be an etched dentin surface by hydrochloric acid. The first commercially available dentin bonding agent in 1950 was based on a surface-active co-monomer which was known as NPG-GMA or N-phenyl glycine glycidyl dimethacrylate. Theoretically, NPG-GMA could chelate with calcium 2+ of the enamel and dentin and form water-resistant chemical bonds. Here we can see that the resin which is having the NPG-GMA and it is chelating with the calcium of the enamel and dentin. The etching of the dentin is needed. Adhesion is smear layer of dentin. It ignores the smear layer on dentin, bonding well to enamel through resin tags, and the bond strength is around 20 to 30 MPa per bond strength to dentin, which is around 2 to 3 MPa, and 50% failure at 6 months. Bonding to enamel should occur in 2 steps: etching of the enamel plus application of NPG-GMA, while bonding to dentin include 1 step, that is the application of NPG-GMA. The second generation dentin bonding agent. In 1978, the Clearfield bond system, which was introduced in Japan, they introduced the phosphate ester of methacrylate derivative, phenyl P and hydroxyethyl methacrylate, otherwise known as HEMA in ethanol. There is a polar interaction between the negatively charged phosphate group in the resin and positively charged calcium ions in the smear layer, and the bond strength was about 5 to 6 MPa. Here we can see that the resin which is having the HEMA and it is bonded to the calcium 2+ positively charged ions in the smear layer. Typically, the second generation dentin bonding involved 2 bottles and 3 steps. Bonding to enamel, it was a 2-step procedure which consists of etching of the enamel plus application of the adhesive, and there was no etching of dentin. While coming to bonding to dentin, it was a 2-step procedure which included application of the phosphate paste, methacrylate monomer plus application of the adhesive. Then coming to the third generation, Curare introduced Clearfield new bond in 1984. This phosphate-based material contained HEMA or HEMA and a 10-carbon molecule which was known as 10-MDP, otherwise 10-methacryloxydecyl dihydrogen phosphate. It included a long hydrophobic component and a short hydrophilic component which is known as the primer. The concept of per bonding system was introduced by the application of a phosphate ester type bonding agent which was introduced by Fusayama et al. In 1979. There was a simultaneous etching of both enamel and dentin, which was contraindicated because it was believed that smear layer protected the pulp by preventing direct contact with the monomer. Hence, only enamel was etched with 37% phosphoric acid. Dentin, on the other hand, was treated with a mild acid which was known as the conditioner. Conditioning include the agents which are used for conditioning include 2% nitric acid, 2.5% malic acid, 10% citric acid, and 3% ferric chloride. Most third generation dentin bonding agents will be having a 2 component and 3 or 4 distinct clinical steps. The enamel bonding, there is 2 step which include the etching plus adhesive, and the dentin bonding which include a 3 step, that is the conditioner was used which was followed by the acidic primer and the adhesive. The advantages include there is a strong bond to sclerotic moist dentin, erosion, abrasion, abfraction, lesions treated with minimal tooth preparation, bonded to dental metals and ceramics. 8 to 15 MPa is the bond strength, and the examples include Clearfield New Bond and Scotch Bond 2. Disadvantage included Limited penetration of the resin's dentin surface, collagen fibers are not exposed and dental tubules remain plugged by smear debris. No hybrid layer was created and moist bonding was not yet a requirement. But because not all of the vital dental tubules were effectively resealed by the adhesive, there was some postoperative sensitivity which can be observed with third generation bonding agents. Coming to the fourth generation dentin bonding agent, this was based upon the total etch concept which was introduced by Fusayama in 1979. There was a simultaneous etching of enamel and dentin for 50 seconds using 37% phosphoric acid of pH 0.1 to zero point 0.6 which was seen. The complete removal of the smear layer and smear plugs via acid etching led to significant improvement in the bond strength of the resins to dentin, which is seen as 17 to 24 megapascal. The resin interim addition was the hybrid layer, which was known as the H&N adhesive, which is a three-step procedure, and the moist bonding became a clinical requirement. The three essential components are etchant, which was 37% phosphoric acid, the etching gel that is rinsed off, primer containing reactive hydrophilic monomers, which is a bifunctional molecule in ethanol, acetone, or water, and the adhesive was a non-solvated, unfilled, or partially filled resin. The three-step application procedure include etch, apply for 15 seconds, rinse for 10 to 15 seconds, gently air dry or blow dry by keeping the dentin moist. To achieve this, after etching and rinsing, the excess water should be blotted with a dry sponge or a small piece of tissue paper which should be just touched to the surface of water and not rubbed or pressed on dentin. Primer, apply 1 to 5 layers gently and air dry. The primer should be applied for at least 15 seconds to allow monomer to diffuse to complete depth of demineralized dentin. Acetone or alcohol-based primers must be applied in multiple layers to compensate for the evaporation of solvent. Water-based primers are left undisturbed to allow collapsed collagen to re-expand. Primer should be then gently air-dried with a short blow of oil-free compressed air to volatilize any remaining excess solvent before application of the adhesive. Bonding, apply one layer of adhesive, gently air dry and light cure. Adhesives are applied and spread with an applicator brush rather than using airs to spread the adhesive. Blast of the air reduces the thickness of the adhesive. Adequate thickness, that is around 100 microns, needed to counteract tensile stresses due to polymerization shrinkage, and this is known as the stress relaxation buffer. Advantages include bond effectively with enamel and dentin, high bond strength when compared to previous generations, and this generation was the first wherein the bonding strength of dentin was greater than the polymerization shrinkage of the composite, and as a result, the composite did not shrink away from the tooth resin interface during polymerization, thereby leaving a gap that could develop into a collector of oral fluids and bacteria. Disadvantage include the drawback of fourth generation system was a need for multiple components. Kits had 3 to 5 components and required 3 to 7 distinct steps in their protocol, a very time consuming and technique sensitive exercise. Certain components had to be mixed equally and in a specific order by chairside. The unequal amount of the components often compromised the adhesive strength of the bonding agent. Coming to the fifth generation dentin bonding agent, it's a two-step etch and rinse adhesive, two-step containing etchant in one bottle, primer and adhesive in a single bottle. It is having a decreased technique sensitivity. The bond strength is around 20 to 25 megapascal. The examples include single bond and prime and bond in T. Two-step application include etching, apply for 50 seconds, rinse for 15 seconds, gently air dry or blow dry while keeping the moist dentin. Prime and bond, apply 1 to 5 layers, gentle air dry, light cure. Primer adhesive combination is left undisturbed for 20 seconds to allow effective and full penetration of resin monomer into collagen fibrils. Excess solvent and adhesive are removed with a gentle stream of air for 10 seconds and blast drying is not indicated. Advantages include more convenient application with lesser steps, lesser technique sensitivity, consistent and stable composition, prevent cross-contamination. There is less post-operative sensitivity, which was observed with the fifth generation bonding agent, typically 5% or less in posterior teeth and quite rare in the anterior teeth. Disadvantages include lower bond strength when compared to fourth generation, weak resin collagen interaction, Time still required for separate etching step followed by rinsing. It could be technique sensitive due to multiple layer application, risk of thin bonding layer, and there is a lack of stress buffer, sensitive to overwetting and over drying. This is the pictorial representation. Here we can see that the fourth generation including a three-step which contained conditioner, primer and adhesive, and the fifth generation which included a two-step conditioner with a combined primer and adhesive. Sixth generation bonding agent. Further demand for the simplification of the clinical steps led to development of the sixth and seventh generation bonding agents. They were categorized by omission of separate conditioning or etching step. The two subsystem consist of a self-etched primer in one bottle which is not rinsed off, and an adhesive which is a hydrophobic non-solvated bonding resin in separate bottle which was applied separately. The single step include all the components which were mixed prior to the application. Here we can see the sixth generation, which is including a two-step self-etching primer and an adhesive resin. Single step, which should be mixed prior to the application, and it includes the single step self-etching dental adhesive. The self-etching system, if a primer has the ability to both etch and prime, it is categorized as a self-etching primer. The acidic primer include a phosphonated or carboxylated resin molecule that perform two functions simultaneously, etching and priming of the dental enamel. In contrast to conventional etchants, the acidic primers are not rinsed off. Primer mixtures have a wide pH range because of variations in the functional groups of the corresponding monomers. The classification of self-etching primers by Van Meerbeek in 2003, depending upon the pH greater than 2.5 is considered as an ultra-mild, only few hundred nanometer will be the priming. pH very equivalent to 2, mild 1 micrometer, and pH 1 to 2 it is considered the intermediately strong, that is 1 to 2 micrometers, and pH less than 1 it is strong, that is several, that is micrometers. Self-etching primer which can be used are hemophosphate, phenyl P, 10 MDP, 4-met and 4-meta. Composition of sixth generation, the primers are similar to third generation. When the concentration of the acidic monomers was increased from 5 to 10 weight percentage, that is for the third generation, to 30 to 40 weight percentage for the sixth generation, and dissolved in 30 to 40% HEMA, which is a water-soluble primer, a pH of 1 to 2 was achieved, which is a low enough to etch through the smear layer. The aqueous solution, the solvent is water for acidic primer in a HEMA base, and the partial demineralization of the smear layer and smear plug, but greater depth of penetration into smear plug and dentin due to high concentration of the acidic primer. These acidic primers are capable of penetrating the aqueous channels formed within the smear layer, whitening the channels and interacting with the underlying dentin. They are known as the smear layer dissolving bonding agents. The external demineralization is smooth, collagen fibers could be exposed. Hybrid layer is formed, smear layer or smear plug incorporated into hybrid layer. Hybrid layer formed has a combination of resin, collagen fibers and minerals. Self-etching primers are also classified into carboxylic acid containing monomers, phosphate containing monomers. The carboxylic acid based monomers include NPGGMA, MAC10, 4-meta, PMDM, and the phosphate based include phenyl P, penta, 6-MHPA, and 10-MDP. The water as a solvent ionizes the acidic primer. As primers are less soluble in water, HEMA, which is water-soluble primer, increase the wettability of the acidic monomers. The sixth generation materials bond to tooth enamel, both enamel and dentin. The dentin bond is 70 to 22 MPa, which is relatively acceptable. The examples include Clearfill Protect Bond by Curare and the ADPA Prom by 3M SPE. Clinical protocol, two-step application process, etch and prime, one application without rinsing, gently air dry, bonding, apply one layer, gently air dry and light cure. As a single step, the components require mixing prior to application. Example, prompt ELPO. Advantages, discrepancy between the depth of demineralization and depth of resin penetration is decreased, leading to less postoperative sensitivity. Simultaneous demineralization and resin penetration do not require etching and rinsing step, hence less chance of overwetting or over drying of dentin. Time-saving procedure, less sensitive to presence of moisture. Disadvantages, do not etch enamel well as phosphoric acids etchants. Then enamel bond strength is low, bond strength to dentin is high. More hydrophilicity promote water sorption, which are known as the water trees. incompatibility with amine initiators in self and dual cure adhesives, and reduced shelf life due to presence of hydrophilic and hydrophobic components in a single bottle. Selective etching versus total etching. The term total etch technique permits the simultaneous etching of both enamel and dentin for 15 to 20 seconds, which is followed by in which the enamel dentin is left moist to prevent the collagen collapse. The term selective etch refers to the procedure whereby only the enamel edges of the tooth preparation are selectively etched with 37% phosphoric acid, while dentin is treated with a self-etching or a universal adhesive. Incorporate the advantages of the selfish technique, which is having the highest bond strength enamel, and selfish technique, which is having a reduced postoperative sensitivity. The bond strength could be compromised and the postoperative sensitivity could occur if dentin gets inadvertently etched with 37% phosphoric acid. 7th generation, the one bottle adhesive or the self-etch adhesive, etch and primer and adhesive in one bottle. They are furnished in a single bottle or ampule that include all the required components of self-etching, surface conditioning, hybridization, desensitization, adhesion, and often fluoride release as well. All the necessary adhesive steps are accomplished chemically by the simple application of the adhesive to the tooth surface. No additional clinical steps are required, no mixing is needed. Hydrophilic and hydrophobic components intricately mixed together, smear layer dissolving dentin bonding agents, and there is a simultaneous removal of mineral phase from the dentin surface while replacing them with resin monomers, which leaves no voids. There is hence less post-op sensitivity and micro leakage. The clinical protocol include one step. There is an application of a 1 to 5 layer without rinsing, generally air dry and light cure. Advantage include unidose application prevents cross-contamination, most time efficient application procedure. Disadvantage, more prone to phase separation as it contains both the hydrophilic and hydrophobic monomers components in one bottle, and it can act as a semi-permeable membrane, allowing water to move in and out of the adhesive layer, which is known as the water tree. Foam a stress buffer, which is around 52 micrometers needed, and a large amount of water or the solvent added to lower viscosity, which is making it difficult to evenly coat the dentin surface and prevent oxygen inhibition. Multiple coats may be required. Clinical performance of one step self-etching adhesive improve with the addition of an extra coat of a hydrophobic bonding adhesive. Bond strength was lower than the 6th generation adhesives. Here is the example, Xenovi 7th generation etch and primer adhesive in a single bottle. Here we can see the pictorial representation, the 6th generation two-step procedure, self-etching primer and an adhesive resin. In the 7th generation, the self-etching primer or adhesive as a two component and the self-etching adhesive as a one component. Coming to the universal adhesive, 7th generation single component. With the advent of universal adhesive, dentists are now using the same dentin adhesive for different adhesion strategies according to each specific or clinical situation. Self-etch, etch and rinse, selective enamel etch adhesive. Because of the multi-strategy approach, this new generation of one-bottle dental adhesives has become very popular in dentistry. The major difference between traditional one-step self-etching adhesive and universal adhesive is that most universal adhesive contain 10 MDP, which is capable of bonding ionically to hydroxyapatite. The acid-base reaction of the 7th generation adhesive on the dentin surface is that of an acid acting on an organic base. This chemical reaction generates organic salt and water. The most important innovation of 7th generation adhesive is the added advantage of moisture independence. Thus, 7th generation adhesive procedures effectively create their own moisture. They can be applied on a moist surface or on a dried surface. To bond with the enamel, unlike with 6th generation adhesive, it is very acceptable. pH of 1 lower or 10 times more acidic than the 6th generation adhesives. Bond to dentin is the highest among all the adhesive group in the range of 23 to 30 MPa and higher. Clinical protocol. Apply the adhesive to the tooth surface. Agitate or scrub if required. After a brief wait, simply air dry the surface and light curing should be performed. Now, after the classification based upon the generations, this is a classification based on the effect on the smear layer or treatment of the smear layer. The classification based upon the treatment of the smear layer. Bonding system that ignore the smear layer include the first and second generation bonding agent. Smear layers and plugs are left intact. Bonded to intact smear layer forms a weak link or intermediate layer preventing resin dentin contact. Then bonding system, which will be there is a removal without disturbing the smear plug, the third generation bonding agent. Removal of the smear layer without disturbing smear plugs. Partially demineralized smear layer or smear plug and underlying superficial dentin without removing dissolved smear layer remnants or unplugging orifices. Limited superficial interaction with the smear layer or the smear plug or the dentin when compared to etch-and-rinse and self-etch adhesives. Collagen fibers are not exposed and there is no formation of hybrid layer. The bonding systems which are used as a complete removal of the smear and smear plug. They include the fourth and fifth generation bonding agents, etch-and-rinse adhesive, total etch complete. There is a complete removal of the smear layer and smear plug followed by demineralization of underlying intertubular and peritubular dentin, exposing a microporous network of collagen suspended in water, followed by optimal penetration of primer adhesive to achieve adequate thickness of the hybrid layer. Bonding system which will be having a sixth and seventh generation bonding agent, which include the self-etch adhesives and the universal adhesive. They contain high concentration of acidic monomers, which is dissolved in 30 to 40% HEMA, achieving a pH of 1 to 2, which was the low enough to etch through the smear layer. These acidic primers are capable of penetrating the aqueous channels formed within the smear layer, widening the channels and interacting with the underlying dentin. Partial demineralization of the smear layer and the smear plug, but greater depth of penetration in the smear plug and dentin due to high concentration of acidic primer. The hybrid layer is formed. Smear layer or smear plug incorporated into hybrid layer. Hybrid layer formed as a combination of resin, collagen fibers, and minerals. Now, the third one, the classification based on clinical technique or number of clinical steps involved. It include the first one, etch-and-rinse adhesive, 3-step, 4th generation, 2-step, 5th generation, self-etch adhesive, 6th generation, which include a 2-step or a 1-step, and the 7th generation, which include the 1-step, and the last one is a universal adhesive, which include a single step. Thank you.